Uh, Good evening, everyone. I'm Dr. Priyash Jain, Assistant Professor in Psychiatry at MGM Medical College Indore and editor of Minds newsletter. And it is my privilege to moderate today's webinar. On behalf of Minds newsletter, I extend a very warm welcome to all our esteemed speakers, faculty members, and student participants. Research often appears intimidating to undergraduate students, particularly when it comes to drafting an ICMR STS proposal. Many students have good ideas, but they struggle with converting those ideas into a scientifically sound and feasible proposal. The ICMR short term studentship program is not merely a scholarship opportunity, it is in many ways the first gateway into research. It teaches the student how to ask meaningful research questions, how to think critically, and how to contribute to the evidence in healthcare. Today's webinar is designed to make the STS process practical and approachable to the undergraduate students. We will discuss how to identify a good research question, how to go about with a title and introduction of the proposal, how to draft a strong methodological and the implications of a proposal, and how to avoid common proposal writing mistakes. We hope today's discussion helps participants move away from I want to do research to more I can write research and submit a strong proposal. Before we proceed, I would like to briefly introduce Minds newsletter. Minds newsletter is one of the India's oldest psychiatry newsletter dedicated to undergraduate and postgraduate students and doctors, serving the academic community since 2011. It has been this year we are celebrating our 15 years of conception of the Minds newsletter. Over the years, Minds has worked towards making psychiatry more accessible, student friendly, and academically engaging for the students. We are grateful to all our faculties, mentors, and supporters, and student readers for their constant engagement with the newsletter, making it a successful endeavor. It is now my honor to introduce our first resource person, Dr. M. Kishore sir. Dr. M. Kishore is professor and head of department at JSS Medical College, Mysore. He's widely respected for his contributions to psychiatry academics, teaching, and research mentorship, especially working with the undergraduate as well as postgraduate students in various kinds of research projects, which makes him uniquely suited for this particular session. He will be throwing light on how to go ahead with the principle of introduction regarding the research proposal. We are extremely grateful to have you with us today. Before I invite him, I want to just inform all the participants, student participants, in case they have any questions, any doubts, they are always welcome in our chat box where they can post their doubts, and we'll try to take as many relevant questions and doubts right after the session. I now invite Dr. M. Kishore sir to deliver his talk.
Thank you so much, and it is a fascinating program to have a national webinar on ICMR STS focusing on mental health research. I'm extremely thankful to Minds newsletter, India's uh, oldest newsletters in 2011, and the editor Priyash Jain from MGM Medical College Indore for taking a lead in considering. I'm immensely thankful to my colleagues, Dr. Pallavi from CMC Ludhiana, who conducted a workshop last year for JSS Medical College Psychiatry Club. She has joined me, and Dr. Snehal Gupta from AIMS Bhopal, a person who has keen interest in research, and his presence and his work in undergraduate education, particularly in relation to psychiatry, is fascinating to know. So it's amazing group, and very young and enthusiastic undergraduates, faculties from various institutions, experts in psychiatry who have joined. I'm really thankful to all of them and giving me the kind platform. So the first thing I would like to take up is when you come across this word ICMR STS research for mental health, the first question undergraduates should ask themselves is, are they interested in mental health? So that is the question they have to ask themselves. Is it fascinating to them to think about mental health? Because ICMR is focusing on first year MBBS and second year MBBS students. So there is some thought process which we think the first year MBBS student should have. What is this mental health? What are the components of mental health, and what they think about mental health, and what is actually mental health? So the whole course of MBBS is to move from assumption to awareness. So whenever you are thinking of this ICMR STS, please think whether you are interested in mental health. And mental health is a very broad area. Let me tell you, because when you think about mental health conditions, psychiatric conditions, and the normality aspect of mental health, it is a huge area. So, whether you want to work with anatomy department, whether you want to work with oncology department, whether you want to work with OBG, or whether you want to work with biochemistry, pharmacology, any subject, I think this is one area which can be entangled with many aspects. And I want you to reflect upon what made you to think about mental health as your priority area. Is it your experience? Is it that you got interest because of what you saw around you? Or is it because that you read something? What exactly made you to consider mental health? That's the first question you should ask. The second question every MBBS student who is taking up should ask is, do you have interest in research? Why you should have this question in your mind is, research for a first year MBBS student and second year MBBS student, especially in the context of ICMR, at some point of time, they think that some great innovations can happen, or some great discoveries can happen, or something outcome might be amazingly well. But sometimes the research is only you are exploring an aspect which is very small and you are interpreting it. And it is also your first step in what are the nitty-gritties of research. What do you mean by research? How to ask a question, how to look for evidence, and how to work up for that particular aspect. So I want all the students who are interested to think about, who are thinking of research. There is a very nice YouTube video by the national, I think, NTPL Swayam portal, which is called Basics in Biomedical Research, which is mandatory for all faculty in medical colleges. Those videos are free. Anybody can log in and look at the content. You'll get some idea which you did not know, because it is very well structured program by the Swayam. And I think it's by the co-authored by the ICMR also. So that is another way for you to understand what is the meaning of research and why are you keen on. So you should have this first question, are you interested in mental health? Second question is about, are you really interested in research? The third and the most important, I would say, is, are you ready to do the work? See, this is something we should always ask. I am interested in mental health and I am interested in research, but I am not interested to do anything on my own. Then there is a problem. So I would request all the students, whenever you have a research idea in mind, whether you think about mental health research, please also think about, are you ready to work for it? This involves time, this involves effort, this involves your concern for it, and it is more than anything, it is your work to try and figure out. So that is the most important aspect I would like to consider. Are you ready to do the work? Because many of the students who take up ICMR STS, they consider that the mentor will do the job, the guide will do the job. No, the opportunity is given to you. You are the bright students who have taken up. So the ICMR wants you to do and try. And what do they want from first year and second year MBBS students? They want them to have a introduction to research, some ideas to inculcate over their professional career. These are the ways the ICMR considers. And when you have taken up this particular aspect, I want to tell you there is a great joy in doing the work. it's really a joyful experience. It should not be converted into a painful experience. Neither it should be uneasy for you, nor should be uneasy for your mentor. So I would request you to consider this as a joyful experience, involvement of your time. And I would request you not to convert everything by use of AI. AI is there to help you. And whenever you think of a research, don't offload every aspect to the AI. Artificial intelligence is not outsourcing your intelligence. Your artificial intelligence should support you and you should be able to take forward, because many people now convert their activity into AI, because AI is fascinating thing. It will give you many aspects. So I would request you not to too much have the lenience towards AI, but use it very in a manner which is supportive for you. Second aspect is that please do not think of anything in the last minute, last day of your process. And especially when you have the whole idea of ICMR STS, please ask one question. Is the work doable? Is this feasible? Can I do this? Do I have the time and interest? And is it possible where you have considered to do this work? At your college, at your hospital, at your community, or wherever the network is? Please also consider this question. Is it feasible when you are considering? So I have put forth four questions to you when you are considering ICMR STS. And I want to tell you, many institutions support ICMR STS projects. Those who have not qualified, the institution themselves have a UG research cell and they support. So please think about beyond ICMR also. And those who have not been able to take up ICMR STS, it's okay. You can still do it. You can continue it. Nobody is going to stop you. It is your area of interest. So I want you to think about it. Very interestingly, there are organizations beyond your institution which support. For example, in Karnataka, we have IPS. Karnataka chapter gives additional funds for undergraduates to carry out research. So this is the whole background I want to talk about. Initial aspect about ICMR STS. And please talk to your subject expert wherever you are. Meet the Department of Psychiatry, ask them some critical question. You can always have mentors from any department, whether it is your guide is from anatomy or surgery. Anybody can be your guide. If it is your mental health is the key aspect, also meet the subject as experts to discuss, because mental health is one area which can go with any subject of your interest, but you should have open conversation. And I also think that if you have a senior who has successfully got the ICMR, talk to them. In every institution, there are candidates who have taken ICMR and they have succeeded. Just ask them what was their experience. Those who did not get also, they are very good. You can ask their experience, because they will tell you what is that they tried and did not work. So these are the couple of questions. In many institutions, postgraduates are also very good to support ICMR STS of the students, because they have some idea when they do their MD thesis. So if you have a psychiatry postgraduate, make sure that you interact and get some ideas about how to think about it. So I have just given a preliminary outlook. And at this point, Priyansh, I would request my colleagues Snehil and Abhilasha also to give some thoughts if I missed anything in the initial part of discussion. And if there are any questions at this point, I would be happy to take it. Over to you, Priyansh.
Uh, Thank you so much, sir, for that insightful and practical discussion that you started. It was quite your words of wisdom that research should rather be a joyful experience rather than a painful experience, and using AI as a tool rather than making it the complete outsourcing opportunity. So that was quite practical for the students. And also taking the discussion beyond the ICMR STS to other possible options where the research can be undertaken, like IPS Karnataka chapter and the institution. I would request Dr. Snehil sir and Dr. Abhilasha ma'am if they have any further addition to the current discussion.
No, like sir said, like sometimes these students just feel that all the work will be done by the mentor. So they need to have that zeal and enthusiasm to complete the work which they have taken up. So sometimes they kind of get exhausted, or they start lagging behind, and then they start like complaining about it. So, but it's like a continuous process. Like to be on it, like keep doing it until unless you complete your project.
Definitely, ma'am. That should be the point of the research, that the student should learn the research process rather than depending on entirely on the mentor for them to complete the research project. So,
And
yeah,
I
that's
think it's helpful for them also in a long
yes,
run.
ma'am,
Like
definitely.
it will help them if they're taking up any postgraduate subject. So
Yes,
it will help in their thesis and how to go about it and how to complete their thesis in a proper way. So
yes,
I think
yes,
it's very, very important. Even if they don't get ICMR grant, I think it's a learning curve for all the medical
definitely.
students.
Definitely, ma'am. Yes. Snehil sir, do you have anything to add to the ongoing discussion?
I think Dr. Kishore has comprehensive highlighted the key critical things when student opt for a STS project around mental health. Uh, I personally believe that whatever topic they choose should be relevant to medical students also, in the sense that this opportunity also gives them some platform to learn psychiatry or mental health, actually, because we know their exposure to psychiatry or mental health is very limited. STS actually gives them a platform to actually learn psychiatry or mental health also. So it's not only research is definitely at the core, but learning the methodology of research, but also to learn psychiatry, which they would otherwise would not be able to learn. So like, for example, if there is something related to a survey on stress, anxiety, and depression, for example, involving medical students or XYZ population, so that they should learn actually what exactly anxiety is, various dimensions of anxiety, what is the issue in assessing anxiety, likewise for stress or likewise for depression, and the overlap between these things. So actually, where is the confusion? And also that will give them an opportunity to have skills of psychiatry, like interviewing skills. It's not only purely based on some survey, but actually doing some kind of interviews and identifying the psychological issues would be of help. So personally, when student come to me, I tell them, you take a topic which is relevant to you as a medical student, anything related to mental health for medical student, for example. So I think that will have greater bearing, because we talk about student mental health and all those things. Some topic related to them will be of help. That is my personal suggestion.
Thank you, sir, for a very apt and very relevant suggestion. That research is not just about ICMR STS is not just about learning research. It could also be gateway into learning psychiatry for undergraduate students. So that is one of the facet of taking mental health research in ICMR STS. Now we seem to be having one question, but it seems to be related to our next session. So I think we can begin with our next session, and then we can take that particular question. So for the next section, I would like to formally introduce the speaker, Dr. Pallavi Abhilasha ma'am, who is an
1 minute,
assistant.
1 minute, 1 minute.
Yes,
I
sir.
have not spoken about the introduction and
Yes, sir.
title.
Sure, sir.
I'll
Yes,
just
sir. Sure, sir. Yes, sir. Sure, sir.
yeah. So then the first and the foremost aspect in the ICMR STS is how to choose the title of your research. What I would request all the students is that you need not give the title with the first words, this is a study of. Most of you consider that this is a study of this, that is a study of this. That is not necessary to be incorporated in the title. It is understood that you are going to do the study. What ICMR expects you is that the title should be short. They have put a limit of 25 words only. Remember, ICMR has given a guideline based on many discussion. So they have said, please keep the title to less than 25 words. That's first thing. Second, keep it short and accurate. For example, you want to look at obesity and sleep disturbances. Let's say you want to try it on your medical students or a community you know of or in the hospital. You will look for association of obesity and sleep disturbance. That itself is a title. So keep it as accurate as possible and you keep it concise to the thing. You need not give explanation in the title. As much as possible, need not have any kind of explanation. Choose the title which is attractive, but it is accurate, and it should also be short and concise, and only scientific terminologies. For example, you want to look at let's say in your anatomy department, many people have come forward to donate their bodies. So you can look at perception of family members who have donated to the anatomy department. So that title gives a lot of information about what is that you intend to do and what is your area of interest. Similarly, you want to look at, let's say, imaging studies in patients with stroke and its association with depression. Now, what were the simple studies carried out? What kind of image findings were there? How did you look for depressive symptoms? So the ICMR wants you to consider the title because there is a dictum in research. If you can't understand the title, there is no point to read the entire research at all. So anybody who can't understand the title may not proceed into looking at the paper. So make the title as simple as possible. Rethink. Sometime if you have 10 different 10 different titles you have sorted out, you can look at which title suits the most for your study. So I think it is very important to spend time on the title because it captures the first attention of the reviewer when they are looking at this. And remember, the reviewer of your topic is a subject expert. If it is if it is linked to anatomy, it will go to anatomy. If it is linked to OBG, it will go to a person in OBG. If it is linked to radiology, it will go to a group of people in radiology. So this is how the reviewer looks at it. So the other way of looking at title is you can go to Indian Journal of Psychiatry or you can go to Indian Journal of Psychological Medicine and look at what kind of titles have been coming. That would be another way of looking at the thing. So spend little more time on the title. That's the first part of it. The second part of it, which is most important aspect, which I'm going to talk about, is the introduction. How to write an introduction. So there is a very clear guideline on which font you have to use. What should be the space? The ICMR tells you you should use only New Romans 12 font, single spacing, and you have to do the justification. Don't underline anything. Don't try to highlight anything don't try to make it in italics. Keep it simple. All the text, it should be clear. And always remember, don't use different types of fonts, cursive writing or anything. So why they have made it as ICMR wants uniform standard. In many journals, this is the standard. When you are taking it for any scientific journal, everywhere they have a standard method of putting the information, font size, clarity of this and this. Now, when you are writing an introduction, I want all of you to look at a couple of things. Start with a broad idea of why this topic is important. For example, you are keen to look at diabetes and depression. So you might start with what is the global prevalence of diabetes? What is the Indian prevalence of diabetes? What is the global prevalence of the depression? What is the Indian prevalence of depression? Then you will tell us how many studies have looked at depression and diabetes from the West and the India. and what kind of controversies are there, what kind of gaps are there, and why your study is meaningful. Why would you like to do? For example, you are looking from community and there has been very less study from the community. So that is the gap you want to fill. So whenever you are writing the introduction, please start from the broad angle and narrow it down to your topic. But ICMR tells you you can have only 300 words. In these 300 words, you should not only tell why this topic is important, what are the reasonable, let's say 2 or 3 studies which have been done in this area, and the last part, what is the addition you are going to do through these things? That there is a gap in this particular area and your study explores to this. And remember, no first person or second person writing is encouraged in the scientific. Usually you tell it in third person. This study tries to explore this. Not that you should not use I would like to study, we would like to study, our institution would like to study. No, these are not encouraged. In scientific language, almost always everything is written in third person. There has been limited information about, let's consider social media and utility of social media and disturbance in sleep. So many people in India are using the social media, this many number of hours being used, and there has been great concern about this particular area. Few studies have explored this and few studies have not looked into this aspect. So ICM wants you to look at rationale for the study. Why is that you want to do the study? Broad messages, at least 2 or 3 related study from India and abroad for your area. Go to PubMed search engine, or you look for Scopus and enter that and see what kind of studies have come in this area, and then bring those studies into it. But please remember, don't copy and paste. Rewrite the words, rewrite the sentences, because copying and copy paste is not encouraged in research. Reframe the words to make sense out of it. That is also art, because many of us now offload our writing skills. I would request you to rework on the sentences when you are putting it across in the introduction aspect. I think to write 300 words, sometime you might require 3 hours. That is how the scientific writing is about. When you are not sure how to write, please take up one journal. You can take, as I said, Indian Journal of Psychiatry is free. Indian Journal of Psychological Medicine is free. Just take one para and see how they have written. So that will give you another idea about how to write an introduction. And please add appropriate references in the brackets. They will tell you how to do it. And don't bring the whole reference into the sentences. So this is the outline of how to write the introduction as per the ICMR thing. Remember, a good introduction is the first which captures that you know what you are doing, that you know what should be done, and that you are aware what has already been done. This is the outline of introduction, and I think any person, even if you give it to your colleague, your batchmates, the person should also be able to understand what is the intention of your study and what you are looking for. And I would request you to look at scientific writing again and again, because scientific writing differs from what the kind of writing you do for magazine, what you have done for the kind of writing you do for the friends, the kind of writing you have tried it in the notes. These are different things. Whereas when you write for ICMR, it is best written in the third person with a language which is appropriate for the profession, and the terminologies should come from the scientific angle. So this is the bit introduction of how to write title and how to write the introduction part, which the ICMR recommends 300 words. But please note, they have also mentioned if there is a need, you can increase that 300 words to 400 words. They have said appropriately 100 more words can be added wherever there is a need, but please do not cross more than that, because then if you elaborate, if you write too much, then they have understood that you have not looked at the guidelines, that you have not followed what is given, and you have not spent time to write this. So this is how the introduction and things are written. If anybody has any question, Priyansh, we can add, and I would request Dr. Pallavi and Snehal also to contribute if I have missed anything in title or the introduction part. Over to you, Priyansh.
Thank you so much, sir, for this very insightful and practical session. Thank you for putting light on how the title should be and giving us that very relevant dictum that if you can't understand the title, there's no point in reading the article. And thank you for introducing regarding the uniform standards and all the practical tips that might be useful to our undergraduate students. By this point of time, we have a couple of questions that I think we can take. Uh, this one is by Pratik Gupta. What are the other areas where we can carry out research or publish research articles or sites related to research?
Is the question related to publication or it is related to how to write?
It seems to be related to rather publication rather than how to write.
Yeah, that part we will take it up
Yes, sir.
later.
Yes, sir. Okay, sir.
In meantime,
Uh,
Snehal and Pallavi can add something.
Yes. So I think the novelty should also be maintained, because most of the kids, what they do is they bring on the same topic what has been done, and they keep writing the same projects. They, like you mentioned, like they do not like change the words, or they copy the same title of the study, and it's not like lucid or clear. So and it's kind of very long. So it should be short, it should be clear, it should be concise, and it should say what it wants to say. So I think and they should read about the research more and more. Like if they should know the area of interest in which they want to like do a research about. So they should go back and read about that particular topic. They should read about the literature review and in depth, and then come back to us and give us their feedback on how much have they understood, and how can we simplify and rectify their proposal.
yes, sir. Thank you, ma'am, for those all the relevant techniques and tips that you shared with us. Dr. Snehal, sir, would you like to add anything, sir?
I think foremost is introduction is actually how you make your case for the current research. So it is kind of you may say you are you are kind of convincing the reviewer that why this research is important. So as Dr. Kishore highlights, start from global, the burden, the global trend, the gap, and become more specific, more narrow. That's what we typically do when writing introduction. And uh, then the research gap you highlight why you want to do this research. There is some gap. You have to identify that gap and then appropriately frame your aims and objective for your research. Most importantly, that Dr. Kishore also highlighted, writing a research proposal is an art that requires lots of practice. So, if the introduction word count is 300, it may happen that you may start with some 600 word or 700 word, but gradually and gradually you have to make your idea very crisp, very uh, clear, not adding too much words which has lesser importance, and being very focused. So if your introduction is clear and focused, that will give reviewer an idea that he's very clear about what he wants to do. But if the ideas are not in alignment, they are not following a flow, then the even reviewer may get confused. And confusing a reviewer is not at all good, because we need to know the reviewers who would be reviewing the STS project. Everyone is very busy. So if you make them work more involving too much of cognitive load on them. So that goes against your proposal. So the whole purpose is practicing. So you prepare draft timely, share with the faculty, get input, further refine it. So doing multiple rounds of reviewing and drafting will make your sections like introduction very crisp. So that what I would suggest, Priyesh.
Thank you so much, sir, for once again, all the relevant tips that you have shared with us and keeping the introduction crisp while also reducing the load of the one who's going to review the proposal. We have a couple of, yes, sir, yes,
Yeah.
sir.
The other thing I missed out is please remember you need to add some recent work also. Now, what is recent? Anything which has come in the preceding few years, you should have searched for. Let's say you want to work about head injuries, and you want to look at those people, let's say, who have developed depression in patients who had head injuries. You have to look what recent understanding we have gained in the past few years, either from India or from abroad, and whether you would like to look at that angle also. So please look at recent literature. Even if there is nothing you can mention, in the last 4 years, let's say there has been no work on follow-up of the patients who had COVID. That's a fantastic case you are putting up. Since there has been limited work on the patients with COVID and you want to explore their experiences, you have put forth very nice angle to the introduction. So I would ask you to look at recent literature. That's one point I missed, Priyansh, and over to you. Yeah, you are asking some question.
Yes, sir. Thank you, sir, for adding this relevant point. Before we move towards the next session, we have a couple of questions, and I think one of them can be taken up now. Uh, it is by Pratik Gupta. Sir, can you also guide about the area of review of literature? So I think most of the part has been discussed regarding the recent literature, 2 to 3 Indian studies. So would you like to add anything else to answer the question, or?
I think as we go further, when we are talking about implications and other things, we can come back to this point again.
Yes, sir. Yes.
Priyesh, I
So
would
now,
like to add here, Priyesh,
yes, sir. Yes, sir.
if allowed. Student need to understand what we call the level of evidence. So, if you are finding a topic, say meta-analysis on systematic review on any topic, that should be cited because that has the highest level of evidence. Then other experimental design like RCT or cohort study. Then comes the role of some kind of cross-sectional study or survey. So student also need to identify which particular research you want to choose, because if your ideas or introduction is based on some good quality research work which has actually more evidence, then it shows that you have done reasonable literature review, and that will give strength to your introduction or your claim also. So this level of evidence should be identified and should be highlighted. I think this is an important part.
Thank you so much, sir, for introducing us to the level of evidence and its importance in research work. So that's a very good addition that we have to our discussion. Now, I would like to move forward to our next session. I would like to formally introduce Dr. Pallavi Abhilasha ma'am, who is an associate professor in Department of Psychiatry at CMC Ludhiana. Ma'am has extensive academic and research experience and has been actively involved in mentoring young researchers and medical students. Her perspective on research planning, methodology, and execution in mental health will be immensely beneficial for our audience today. Ma'am, we sincerely thank you for taking the time to join this academic initiative. I now invite Dr. Pallavi Abhilasha ma'am for her session on planning the methodology.
Good evening, one and all. Thank you, Kishore sir, for giving me this opportunity, and Dr. Priyash and Snail sir for sharing this session with me. So I'll be talking about principles of writing methodology. So I have prepared like a few slides, and as we know that methodology is the most important part of the proposal, and it carries major weight during the selection process of an ICMR study. So we'll be discussing how to write up the methodology part. So I'll start with the first slide, that is what is the novelty with practical relevance. So methodology should help answer a meaningful and relevant question. So projects score better when the topic addresses a local or a public health
Uh,
need. The results may improve the practice.
Excuse me, ma'am.
Yes,
Ma'am, sorry to be interrupting. Ma'am, we are not able to see your slides. If you can share your screen.
just a minute. Just are you able to see now?
Yes, ma'am. Yes, ma'am. It is now visible.
Sorry,
Thank you so
sorry.
much, ma'am. Thank you so much.
So the first slide is basically the novelty with practical relevance. So methodology should also help us answer meaningful and relevant question. So a project will score better when a topic is addressed in a local or a public health need, and results may improve the practice and the population is relevant. Uh, a strong STS methodology usually appears, should be like practical, should be focused, should be realistic, it should be ethically appropriate, it should be statistically sound, and it should be easy to execute. Study design and selection, which is the first criteria. So, experimental studies and clinical trials are not approved under the STS program. So, observational studies are relatively easier to conduct at undergraduate level and they have a higher chance of selection. So, these include cross sectional studies and case control studies. And people can do cohort studies, but it is beyond the scope of STS, especially for the undergraduate students. So it is crucial to choose a design based on the resources available at your institution and the time which is permitted. And as STS has only 2 months to finish their project, so they should be very, very clear and how feasible it is for all of them to finish the project within 2 months. So again, coming to the objective. So it should specify what kind of knowledge the study is expected to obtain, and the objective should be clear. It needs to be described. It needs to be determined, identified, compared, or confirmed. So hypothesis may be stated, and objective should be specific, to the point, and achievable. So as we know, like we divide objectives into primary objective and secondary objective. So for example, to determine, to assess the risk factors, to compare the groups. This is how we can write. So one example that I can also give is, for example, a person wants to do psychiatry morbidity and its association with glycemic control in children with type 1 diabetes mellitus, a cross-sectional study. So what could be the objective? Like, so you can write, estimate the prevalence of psychiatric morbidity in children with type 1 diabetes mellitus and assess the relationship between psychiatric morbidity with HbA1c levels. So this is how you can write your aims and objective. So your objective should be specific. It should clearly state what you would be trying to achieve, and it should be also to the point and achievable for a 2 month research study. So why is it all important? It is important because we need to have a clear alignment between the objectives and the methodology. So sometimes all when a student write a research proposal, it is not clearly aligned. So objective will be something different, primary will be different, secondary will be different, and the study design will also be it will be very tangential. So it should be all matching logically. So, for example, to assess the prevalence of anxiety among medical students, so suitable methodology should be cross-sectional study. So validated scales that can be used could be HAM-A or generalized anxiety disorders 7 scale. So again, the second thing is feasibility within the STS timeline. So as I already told that you guys have like 2 months to finish this project, and the reviewers look for small to moderate sample size. You need not have like 200, 250, 500 sample size where you are not able to finish your work. So it should be easily accessible participants. It should be simple procedures. It should be minimal follow-up. You can use OPD, IPD patients which are already available. You can use questionnaires. You can use surveys. You can use existing records. So whatever is easier for the medical students, because they also have to attend classes and do their routine work which they're doing, but it should be easier. It should not be something like a burden on them. So they should know where they are collecting data from. So again, it should be very simple and appropriate. The design should be very simple and appropriate. So a well chosen simple design is preferred over an unnecessarily complex one. So either you can use a cross sectional study or a questionnaire based study or an observational study, a complex methodology without justification. It obviously will reduce your score. So study setting should be, again, the next heading should be your study setting. So where are you actually conducting the study? And as mentioned in the ICMR, it's better if you do not write your institution name or the college name. You can just mention your district name. For example, you are doing so and so study in a tertiary care hospital in Ludhiana. So something of that sort. You can mention the district name without mentioning your college name. So study duration. Again, you have to keep it realistic for STS project. So the study will be conducted again for 2 months, and then study population. So who is going to participate, from where they'll get selected, which age group, from which clinical category. For example, the study population will include adult patients aging from 18 to 60 years attending the psychiatry OPD in a tertiary care center during the study period. And your study population, as I mentioned, they should be accessible, they should be clearly defined, it should be feasible for UG students, so they can take medical students, they could take caregivers, they could take interns, they can obviously visit a nearby school, so they can take up adolescents. So it should be easily accessible to all the UG graduates. So again, the next heading should be inclusion criteria and exclusion criteria. So inclusion criteria mentions who are you actually taking a further study, who can actually participate. So for example, 18 to 60 years of patients are taken for the study. So diagnosed cases of generalized anxiety disorder and people who are willing to provide informed consent. And exclusion criteria likewise, like who are not willing to participate. So people with cognitive impairment, people with severe medical illness, and people who are refusing to give consent. Again, adequate sample size. So sometimes UG undergrad students are, they become very worked up about the sample size. Ma'am, the previous review of literature, what I read about, they had 200 patients. How will I go about it? So they should understand that it should be reasonable, it should be justified, it should be achievable, because they have to finish in 2 months of the time. If they take up, like I said, like if they take up 1,000 patients or 500 patients, and if they are not able to finish within the given period of time, I think the project is not going to get completed. So mention how the sample size was calculated and justify the convenience sampling clearly. Like you should avoid using very small unjustified samples, unrealistically a larger sample size that you have taken. So it should be very reasonable, justified. How have you achieved it from the previous review of literature, previous study? Mention the sample size calculation, and obviously reference it, from which study have you taken. Again, proper sampling method. Clearly explain participant selection. Is it a prefer? What all is preferred? Basically, consecutive sampling method, random sampling, systematic systematic sampling, and acceptables are convenient sampling if it is justified. So unclear recruitment is a very common weakness. So we do not know how to clearly recruit the patient. So it is easier if we take like convenient sampling. So it's easier for the undergrad students also. So eligible participants fulfilling the inclusion criteria will be recruited consecutively. Again, what are the validated tools that you use? Generally, you use standardized instruments, for example, PHQ-9, GAD-7, DASS-21, WHO Quality of Life Index, then PSQI, then reviewers value. So it should be reliable, it should be validated, and it should be comparable with other literature. So again, statistical analysis, you should keep it very simple. For example, you write it like data will be entered using Microsoft Excel and analyzed using SPSS version 26. So descriptive statistics such as mean, standard deviation, frequency, and percentage will be used. The chi-square test and t-test will be applied where appropriate. A p-value less than 0.05 will be considered statistically significant. This is how you should mention in your statistical analysis. Again, clarity. So ICMR reviewers may read proposals very quickly. So it should be very striking that your methodology is very concise, it is very organized, it is easier to follow, it is free of jargon, and you should obviously avoid using long paragraphs, unnecessary details, and if you copy from AI or other literatures. So I think it should be very, very organized and concise. And it should be easier for, because they are reading so many, proposals are there. So it should be very, very striking. Again, avoid choosing the topics that have been extensively researched. For example, the effect of screen time on sleep quality of medical students. It has been researched. So you choose a topic which is, quite relevant to the present. And even if doing it, do it in a your objective should be very clear. So novel ideas have a higher chances of getting selected, and in case you get any idea of the topic on your own, you can directly approach your faculty, and I think they will suggest how to work on it and how to go about it. And once you have settled upon a topic, it is very, very important to do a literature review of the same, like we have discussed in the introduction part of it. So research is meant to fill the gaps in existing knowledge and dig deeper into a topic. So when you're doing a research, we also know more of psychiatry. We know how to how your research can be meaningful to the society. So hence it is very crucial to know what work has been done in your selected area. Thank you so much.
Thank you so much, ma'am, for that exceptionally practical discussion and letting us know about what are the do's and don'ts while selecting a particular methodology and
Yeah,
making
and I
a
forgot
proposal more
to,
refined.
sorry, Priyansh, to
Yes, ma'am. Yes, ma'am.
interrupt you. So the what objective should be 100 words, and methodology should be around 800 words, as mentioned in the ICMR STS guidelines. So that has to be followed.
Yes, ma'am. So once again, thank you, ma'am, for all the practical suggestions regarding the methodology, and I'm sure that participants found those suggestions extremely useful. I request Snehal Gupta sir and Dr. M. Kishore sir if they have anything if they would like to add anything to the discussion regarding framing the methodology section.
Yeah. I think Dr. Pallavi can stop sharing the screen.
Yes, sir.
One thing is that I think one of them have also asked about methodology. When you have chosen some kind of research, also look at the existing literature, what methodology they have used. Would you like to use the same methodology? Would you like to differ from the methodology they have used? So, looking at similar studies also will give you idea. Is it a survey they are looking at? Is it a chart review they have done? Can you do that in your institution? So, right away take is about if you have the existing literature, it will already give you the idea what methodology might be working and you can change some aspects of it, or you can modify it based on the your key question, converting your methodology to answer the question you have raised. That could be done. Yeah, this is my opinion, Priyansh. Over to
Thank
you.
you so much, sir.
Yeah.
Thank you so much, sir. Snehal sir, would you like to add anything?
Just one thing, one sentence. Methodologies should be written in a way and should be so well aligned with the objective so that it can be reproduced by anyone. Any other student would like to do the same research. Your methodology should be that much clear, crisp, and in alignment. As Dr. Pallavi also told, the methodology should be in alignment with your objective and the outcome measures that you are using, or even statistical analysis that you will be doing. Try to be as specific as possible. Don't just say we'll be uh, kind of assessing the relationship between the variables through appropriate tests. This is very vague. That shows that you are not prepared, or the you have not put enough effort in identifying what exactly you want to do. So do specify the variables, which is dependent variable, independent variable. If it's a prevalence thing, again, which particular statistical test you will apply, in which way you will report your finding. So I think all these small things are very important. Students read some papers, discuss as much as possible with the faculty mentor, multiple round of sitting discussion. And I personally feel it's not merely about getting a STS project, it's about the learning. So the process provides you more learning options than the end result. So if you have this mindset that I want to learn through this process, definitely your proposal will be great and most likely you will get a STS project.
Thank you so much, sir, for that valuable addition regarding the reproducibility of a research methodology, and not just doing research for the sake of research, but for the sake of learning. So that was quite a valuable addition, sir.
Yes, there is
Now,
one question which
yes, ma'am.
Devdeep Ghosh has asked. What methodologies can we take to measure mental health status? So, can I answer that question?
Yes, I'm sure, ma'am, sure.
Devdeep, I think there are various other tools that you can use. Like you can use semi-structured clinical interview. You can use symptom checklist, and interview schedules, and again your FGDs, focus group discussion, which comes under qualitative analysis, in-depth interviews, open-ended interviews. So, for example, like about the burnout, like emotional well-being, stress. So you can like foster family planning. So you can do like FGTs or open-ended question, thematic analysis. So behavioral observational methods. So these are the other methods that can be used to measure mental health status.
Thank you so much, ma'am, for that addition. I think we have another question that, ma'am, your session might have touched upon or has quite elaborated on it. This is by Devdish Ghosh. What are the feasible methodologies we can carry forward as a UG student to assess mental health with public health basis? So, ma'am, would you like to add anything? I think the
Uh,
question is regarding feasible methods for the UG students. I think your session has already talked upon the particular
yeah.
question. There was one another question by Iduki, who has asked that are chart reviews a good option for STS projects? Would you like to?
It is a good option, but is it like how feasible it is? Again, like, will they be able to finish within a span of like 2 months? And first of all, doing a chart review for undergrad, that I think it will be a little tougher one. So we need to train them first how to go about it, and then only they can start doing chart review. Yeah.
Yes, ma'am. Yes, ma'am. Thank you, ma'am. I think now we can move ahead to our third and a very important session. I would like to formally introduce our next speaker for the session, Dr. Snehal Gupta sir. Dr. Snehal Gupta sir is an associate professor in the Department of Psychiatry at AIIMS Bhopal. Sir has been actively involved in academic psychiatry, research training, and mentoring students in scientific writing and methodology. His insights into proposal implications will be extremely valuable for students planning to submit their STS applications this year. So thank you for joining us today. I request Dr. Snehal Gupta sir to kindly continue the session.
Thank you, Priyas, and my sincere thanks to Dr. Kishore for giving me this opportunity, and also to Dr. Pallavi for being a co-speaker and provided useful insight. So the part that I have been asked to cover is the research implication and referencing thing. So as it means research implication, and one has to write this in 100 words. And research implication has two components. Can I just give me a second, just a second. Sorry for the interruption. Yeah. So research implication in 100 words. So they have mentioned two particular things: how your research work will lead to advancement of science first, and what how it would have implication on students' knowledge and skills. So only two things. So first is the research scientific advancement. So as we have already discussed, whatever research you would like to do, it should be novel in terms of a new idea per se, or an existing idea done in a novel new situation. And since it is a student population in Indian setting, so this becomes something which is relevant to our context, which is relevant to student, his or her phase of the curriculum, and maybe to the target population also. So if you are doing something, say, on neuropsychiatric issues among person with tuberculosis, so your research work should have some implication on the individual suffering from tuberculosis, their mental health status, their quality of life, the drug interaction or impact of their drug on their mental health. So on the target population, on the system per se. So for example, if you propose some kind of you want to see what could be the impact of psychological uh, issues on their outcome of tuberculosis or adherence to treatment. Now, this would have an implication on the patient or the target population, but it will also have an implication on the system. If through your research findings, system starts following something, so that will be beneficial to the system. And definitely research should not be just for the sake of research. The findings should try to bring about whatever tangible or feasible change that is expected or that can be brought. So something that has implication for the target population. So if your studies on medical students, so definitely the implication would be on mental health aspect of student in terms of assessment, in terms of intervention, whatever, on the system. And the third part is on student. And I would give more weightage to this particular part. Ultimately, the whole process is to promote learning among the student. So at the end, what a student learner would get out of the research work in terms of knowledge and in terms of skill. And this I had told in my introductory talk, that you should have a methodology that allows you to explore a particular field. To say, if you are doing something related to lab, so the methodology should be such that you should know the calibration thing, how actually test is done in a lab, how the results are interpreted, how it is handled, how a sample is handled. It can't be like that, okay, it will be left to the technician to do everything, and you are just being a licensing officer between the patient and the lab. No. So ultimately, in a given subject, what knowledge have come up following your research, and what skills you have learned, so that you can utilize it in a better way. Hence, it brings me to next part. It is always good if your research is an integrated kind of research. If it involves multiple department, say one of the research work that got approved from Indopal, it was on pharmacogenomics for various psychotropic medications. So pharmacology department was involved and psychiatry department was involved. So student has an exposure of both the department. She learned about pharmacogenomics. She also learned about psychotropic, psychiatric conditions. So this kind of thing. So I think these are in terms of implication. Referencing, it is mentioned in the guiding document itself. We should follow Vancouver style. That means in text there is a number 1, 2, 3, 4 in a sequence, a chronological order, and usually should be those references should be taken from PubMed indexed. It should be of PubMed index journal. Basically, it indicates a good quality research work that you are citing. Cannot be a journal which is not indexed. So its finding may be challenged or questionable. And as Dr. Kishore highlighted, references should be more recent first. And as I told, level of evidence should be given priority. So if you can find some literature on systematic review or meta-analysis on a topic, better, and then follow more of an experimental studies if you get. Uh, One most important thing students should learn, there is a reference management software. It makes your life very easy, and it kind of actually makes the quality of referencing also very automated, good quality, and reliable also. So there are various reference management software which are also freely available, like Zotero is a freely available software. It is very easy to use, and your faculty mentor will help you in utilizing those softwares. There are tutorials. Likewise, there are other softwares, Mendeley, EndNote. EndNote is a paid one. So these are the small softwares also you should know that you can use. So I think, Priyesh, these are the two things I would like to highlight. Thank you.
Thank you so much, sir, for this enlightening session. Thank you for guiding us on how to write the implication and how to manage the references. One of the highlight that I found was that how you mentioned a few reference managing software like Zotero and Manly, which are quite resourceful when you have to manage a lot many citations. I request Dr. Abhilasha ma'am and Dr. M. Kishore sir if they would like to add anything to the implications and the referencing part of the discussion.
Yeah, I would like to add implications need not be a great change in something which we do not know. For your study, what is the implication? For example, you have looked at premenstrual syndrome among medical students, and you want to write about the implication. You say that one of the implication is early identification of premenstrual syndrome. And if we identify early, we are likely to address that problem and the consequence can be reduced. So look at your study and write the implication. What might happen with your study? What will we understand with your study? How that study is going to help as a scientific community or through our profession or to the condition. These are some of the simple strategies to write the implications. Usually, if you take up any journal, which is a standard journal which we have been telling, you can look at the articles. When they write about discussion, they would have given the importance of implication, how this study has helped. So whenever you get confused, please pick up a standard journal, pick out on original research, look at it, including the Dr. Snehil has given very nice utility of Zotero. But if you take a journal and you look at the reference, you follow the same pattern. Usually, almost all journals follow Vancouver. Some there might be difference. You look at the way it is being approached, whether you are citing a book, whether you are citing another article, whether you are looking at a conference proceedings, there are some subtle changes in how to note it, or let's say you are looking at a document by the government. Government has released a document on diabetes in India or mental health in India or alcohol in India, and you are referring to that document. So your Vancouver system gives you opportunity to refer to any of these sources in a manner which it should be referred. This is one point over to Pallavi.
Sir, I would just want to add that maybe they can try a recent 5 years article, recent citation of the article, which could be added, and mostly, the Indian articles which should be cited in the STS proposal, which is maybe recent 5 years. If you write, 1980s and 1990s, so it kinds of give a bad remark to your project.
Thank you so much, ma'am. Thank you so much, sir, for your valuable additions. So now I think before we end the session, we can come back to a few questions. One of the question was by Pratik Gupta, who asked regarding where can an individual publish an independent research. Kishore sir, would you like to answer the question? Where can a UG student who has done a research, some of the appropriate journals where they can publish their research?
Yeah, I was saying that please look for journal information. The journal information tells what is this journal about, where it is indexed. I would recommend it should have minimal DOAJ index. That's the basic indexing recommended by the National Medical Commission and also, I think, ICMR also. Beyond that, it can be Scopus, Web of Science, and many other things. But to begin with, if the journal is not even indexed in DOAJ index, please do not publish your study in that. Sometime if you go and present in a national conference, usually the proceedings of the conference are published in that respective journals. But there also, please be sure whether that journal in which the proceeding comes, whether it is DOAG. So this is my opinion on this aspect. Snehil and Pallavi can also add.
Yes. Snehal sir, would you like to add anything? Would you like to add any relevant journals where the students can approach?
Actually, STS project can also be kind of published as a brief report. So even a good journal, rather than having a full paper, a short paper, a brief report, like Asian Journal of Psychiatry has a brief report of around short communication of around 1,500 words. Likewise, Indian Journal of Psychiatry has brief report. One of the MBA student from our institute has recently published a paper. So it completely depends upon your research topic also. If your topic is something which is rare or interdisciplinary, then your target journal would go according to the topic also. So this is important. If it's on psychosomatic or consultation lies in psychiatry, then you should check for those journals. Some journals are quite broad, like Indian Journal of Psychiatry or Indian Journal of Psychological Medicine. They are very broad. Then there is Indian Journal of Social Psychiatry. So they may look for some social kind of topic. So I think publication can be considered at a later stage. Here we should focus more on STS reporting. I think that is a subsequent part.
Yes, sure. Thank you, sir. Thank you, sir, for your valuable suggestion. I think we have been through all the queries. Now we can move towards our closing remarks. As we come to the end of today's webinar, I would like to express my sincerest gratitude to all our esteemed speakers, Dr. M. Kishore sir, Dr. Snehal Gupta sir, and Dr. Pallavi Abhilasha ma'am, for sharing their valuable time, their expertise, and a very relevant and practical insight with all of us into how to draft a successful proposal for ICMR STS project. Research can be seem like a mountain and it can be seem like a big hurdle, but once you have correct guidance, correct support, and all the relevant tools, it can become easy. I also thank every participant who joined today and every participant for asking all the questions in the chat box with their vibrant doubts that they had. I encourage all the undergraduate students and all the students who have attended the session to kindly approach the ICMR STS program with a positive attitude and with the aim to enjoy the process rather than thinking of it as a pain or burden. I once again thank all the speakers and all the participants for making the session a successful endeavor. Thank you, everyone.
Thank you. Thank you, everyone.
Thank you so much, sir.